This is Kenya News Update today. 16,297 people in one South Sudanese state are living with a secret. A secret that could be in your neighbor's house, your friend's family, or maybe even yours. But here's the twist. This isn't a story of despair. It's a story of a hidden war, a shocking 95% awareness rate, and a 1% drop in new infections that's changing everything. Coming up, you'll discover the silent battle in Western Equatoria and why a slight reduction is being called a massive victory. Meet Elizabeth Dominic Dabai, the focal person for information in the state's HIV/AIDS Commission. For her, these aren't just numbers. They're 16,297 lives. On Monday, she revealed the 2025 data, compiled across all 10 counties, a marginal change from 2024's 16,200 cases. But here's what nobody's talking about: the journey behind that tiny number. For 9 years, this fight has raged. But then something shocking happened. The commission pushed, they tested, they treated. And in 2025, 15,295 people knew their status. 14,073 were enrolled on treatment. That 95% awareness figure is staggering for a region with such challenges, but here's the part that will blow your mind. Acting chairperson Paula Avoro revealed a nearly 1% reduction in new infections. 1%, it sounds small. But in the world of HIV prevention, it's a seismic shift, attributed to expanded testing and relentless awareness campaigns. The most affected group? People aged 15 to 35, with girls more vulnerable than boys. This is the frontline, but the escalation reveals a deeper conflict. Despite the progress, adherence to medication remains a huge concern. Gaps in follow-up, gaps in viral load monitoring, gaps in consistent drug use. The Commission faces operational nightmares, limited mobility to monitor programs across vast counties, salary delays for dedicated staff, inadequate office infrastructure. They're fighting a war with one hand tied behind their back. Partners like FCIDA, SSG, and CMMB work with the State Ministry of Health. They do free testing drives. They distribute agro tools and seeds to support livelihoods. They use radio talk shows, workshops, banners, and posters. But funding gaps are real. Stigma is a silent killer. And then the impact hits. This slight reduction is a controversy of hope. Some say it's proof the strategies are working, that community education and partner collaboration are saving lives. Others say a 1% drop is a drop in the ocean when 16,297 people are still living with the virus. The tension is clear. Is this a victory or a reminder of how far there is to go? But if awareness is at 95% and treatment is expanding, why are new infections still happening? The payoff brings us back to where we started: 16,297 cases. A number that represents both a crisis and a community fighting back. Do you think a 1% reduction in new infections is a sign of success or a call for a much stronger response? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news from across East Africa.